Hope everyone who are all watching my YouTube channel are learning something from my sessions. Please subscribe to my channel and circulate among your circles, mention comments, and click on like button to help the people who are in need and improve myself. So today our topic is common ED procedures. As I have been receiving comment from the most of the people required to learn common ED procedures. So I have planned to start common ED procedures today. So first procedure usually performed in the ED is smoking cessation. So how to stop the smoking? Here smoking cessation, colloquially quitting smoking, is the process of discontinuing tobacco smoking. Tobacco contains nicotine, which is addictive, making the process of quitting often very prolonged and difficult. The codes are time based. Here, if the patient comes to the ED, physician will counsel the patient to stop the smoking and he will guide him to stop the smoking. Otherwise, what are the problems going to happen in the future? Physician will explain to the patient. These smoking cessation codes are time-based codes. So we will check how to use the modifier here. Use of modifier 25 is required on the E&M code. Identify smoking cessation counseling as a separately reimbursable service. So for example, if the patient come to the ED and the physician performs smoking cessation, we need to code 25 modifier to E&M code. So what does it mean? Smoking cessation is a significantly separatable evaluation performed by the physician. So if you check in the CPD book, this smoking cessation codes come under behavior change interventions individual. So we have two codes here. First one is 99406 and 99407. 99406, what is mentions? Smoking and tobacco use cessation counseling visit intermediate greater than 3 minutes up to 10 minutes. So means we can't code if it is less than 3 minutes. So it must be greater than 3 minutes and less than 10 minutes. So one more code is 99407. This is smoking cessation in intensive greater than 10 minutes. So if the patient takes more time to understand the problems with the smoking, it may take more than 10 minutes also. At that time, we need to code 99407. So we have one guideline. Do not report 99407 in conjunction with 99406. So what does it mean? We can't code less than 10 minutes with greater than 10 minutes code. We will see one example. Patient came to the ED and the physician performs 7 minutes of smoking cessation counseling. What will be the code here is 99406, as 7 comes in between 3 to 10 minutes. So for example, if physician takes 15 minutes, we need to code 99407. For example, if physician takes 2 minutes, we no need to code, as the code description itself telling that if you see 99406, it is telling greater than 3 minutes up to 10 minutes. So if it is 2 minutes, we no need to code. So here we will check what are the requirements for smoking cessation. First one is patient should use tobacco regardless of whether they have signs or symptoms of tobacco related disease. So, so to perform smoking cessation counseling, patient should use tobacco whether he has symptoms or not. So second point is patient is competent and alert at the time that counseling is provided. So that means patient should be aware what is going on surrounding him so that he can understand what the physician tells. Third one is patient for whom counseling is furnished by a qualified physician or other Medicare recognized practitioner. So overall, if it is 1 to 2 minutes, we will not code anything. Directly we will code ED visit. So if it is 3 to 10 minutes, we will code 99406. If it is more than 10 minutes, we will code 99407. So if the physician counsels the patient, we need to add 25 modifier to E&M code. If it is more than 3 minutes only. If it is less than 3 minutes, we no need to code 25 modifier and smoking cessation codes. So next common procedure in ED is CPR. What is meant by CPR? CPR is cardiopulmonary resuscitation. So when do we perform CPR? CPR is performed when the patient's heart and lungs suddenly stop. CPR involves the provision of cardiac life support including chest compression and ventilation of the patient. CPT states 92950 is intended to describe CPR to restore and maintain the patient's respiration and circulation after cessation of heartbeat or breathing. So CPR, most of the people aware this process. It is useful for our routine life also whenever we see a patient with arrest of cardiac action. So basic CPR consists of assisting the victim, opening the airway, restoring breathing, example mouth to mouth, bag wall mask, and restoring circulation, like closed chest cardiac massage. So assessing the victim means we need to check what is the position of the victim, opening the airway. So we need to open his mouth and restoring breathing. If it is possible, we need to do mouth to mouth air. Otherwise, we need to use bag wall mask and restoring circulation, closed chest, cardiac massage. We need to do. So CPR consists of these four processes. First one is assisting the victim, opening the airway, restoring breathing using mouth to mouth bag wall mask, and restoring circulation using the closed chest cardiac massage. So if we check CPR code 92950 in CPT book, it shows us cardiopulmonary resuscitation, example in cardiac arrest. During the cardiac arrest only, we need to use cardiopulmonary resuscitation. Otherwise, wherever it is needed, we can do that CPR. So we need to check see also critical care services 99291 and 992 for 99292 for other services. Like smoking cessation, here also we need to use 25 modifier. So to consider CPR, the documentation should reflect the provider's presence and or oversight. Oversight means sub-process of CPR like CPR started, CPR in progress, CPR discontinued. So provider must be oversight whenever we perform CPR. So provider must and should need to stay at the CPR location to code 25 modifier. So when an E&M code and this procedure code are reported for the same patient encounter, the E&M code should have the 25 modifier attached. So whenever in the ED, if the physician performs CPR, we need to code 99282 to 99285 and we need to add 25 modifier for to those E&M codes. Mostly as per the code description, CPR will be performed during the cardiac arrest. Next, common procedure in the ED is chest tube insertion, tube thoracostomy. So what is the purpose of this? So a chest tube can help drain air, blood or fluid from the space surrounding your lungs called the pleural space. Where is the pleural space located? It is in between the lungs as well as the chest wall. So in between the lungs and chest wall is the pleural space. To drain the blood, fluid, air from the pleural space, physician will insert chest tube or tube thoracostomy. Usually we will cut chest tube insertion, also referred to as chest tube thoracostomy. Stomy means artificial opening, thoraco means thorax, chest wall. So we have one code for chest tube insertion tube thoracostomy, that is 32551. Tube thoracostomy includes connection to drainage system when performed open. If you see in the book, 32551 tube thoracostomy includes connection to drainage system like water seal when performed open, separate procedure. So separate procedure means we can't code this code with complex procedures. If the physician performs only chest tube insertion, we can code this one. Here we have one guideline. Do not report 32551 in conjunction with 33020 33025 if pleural drain or chest tube is placed on the ipsilateral side. Ipsilateral side means same side. Contralateral side is opposite side of the. So here we have one question. So what code should be reported for open placement of a tube thoracoscopy with connection to a drainage system to treat hemothorax? Hemo means blood. So hemothorax means blood in the thorax area. Answer is report code 32551. Tube thoracostomy includes connection to drainage system when performed open separate procedure. So usually this stomy suffix means artificial opening. So here thoracostomy means artificial opening the thorax. So it is a temporary opening. As soon as the hemothorax will get evacuated, physician will close this thoracostomy site. So one of the most common procedure is in the emergency department is splint application. To code splint application, we need to know the purpose of the splint and who will perform the splinting. So what is a splint? Splint is a device that provides emergency immobilization for any injury suspected of fracture, dislocation or subluxation. So the definition itself informs that emergency immobilization. Immobilization means stopping of movement of the joints. So it might be fracture, dislocation or subluxation. So here fracture means we know that breaking of the bone. Dislocation means movement of bones from one location to another location completely. Subluxation means here only partial bone will be dislocated, not complete bone. So dislocation is severe, subluxation is minimal. Usually we have two types of splints. So static splints and dynamic splints. We will know static splints. So what is meant by static splint? Static splints keep an injury immobilized to be used as the default type if static dynamic is not documented. So static splints will not move the injury. Immobilized means they will not move the injury. And default type is static. So whenever if the physician does not mention static or dynamic in the reports, in the ED reports, we need to take as static as default code. So next one is dynamic splints. Allow for movement. Splints that have a joint are hinged. So dynamic splints provide minimal movement of the injury site or joint site. Usually if the physician applies ace bandages, crutches, slings, post-op shoe or boot, we no need to code from physician side. Facility will code all those things. And also the splint also if the physician performs only splinting, we need to code in the physician setting. If it is in the facility setting, hospital will code for these supplies. If nurse or other staff performs printing, it will comes under facility reporting, not physician reporting. Only physician performs himself, we need to code these CPT codes. If nurse or other healthcare providers apply splint, it will comes under facility reporting. So here we have few codes for splints like 29105 application of long arm splint shoulder to hand. So it is very long length splint. 29125 application of short arm splint forearm to hand static. So it is half of the arm. Static means it is stationary, it will not move like dynamic. 29130 is application of finger splint static. Do not use when thumb is splinted. For thumb use short arm splint. 29505 application of long leg splint thigh to ankle or toes. 29515 application of short leg splint calf to foot. So whenever we see the splint documentation, we need to check the location where the physician or nurses applies the splint. So if it is long leg 29105, if it is short arm 29125, if it is finger splint 29130. If it is a long leg splint, we need to code 29505. If it is a short leg splint, 29515. So if thumb be splinted, we need to code short arm splint. So usually there are two types of fracture care provided in the ED: definitive care, non-manipulative. Here the patient is provided pain management and the fracture is stabilized by immobilization. Usually small bone fractures that are not displaced are provided definitive care in the ED. So non-manipulative means physician will not touch the fracture site and he will not do any manual pressure on the fracture site. It called non-manipulative procedure. So for these small fractures, he will use immobilization using the splints. So in the ED, two types of fractures we will treat. Small fractures, if it is small fracture, physician will do the immobilization. If it is a long fracture, long bone fractures, he will do definitive care means complete final treatment. So basically splints are temporary treatment and definitive care is permanent treatment. So we need to check few key terms to be identified from the report. Radiological confirmation, pain medication, immobilizer application, follow-up greater than 48 hours. For example, a phalangeal fracture is treated by placing the finger in a splint or by buddy taping. A stable non-displaced rib fracture is treated by taping and respiratory therapy such as breathing exercises. Braces or splints are not used because they restrict normal chest expansion and can lead to pulmonary complications. A nasal fracture is treated by ice packing and pain medication and so on. So usually these splints will be used in the fractures only. Chest we will not use as it will restrict the chest movement so that it may create the respiratory problems. So during fracture care we need to understand two terms: restorative and manipulative care. So displaced fractures are treated with manipulation to restore the bone to the correct anatomical position. So displaced means it will become two parts and movement is not correct. So displaced fractures are treated with manipulation means physician will manual pressure and align two bones in one line or correct anatomical location or position. To perform manipulation, physician will use traction, flexion and extension or medial or lateral rotation to restore the displaced bony fragments to their original positions, after which the provider immobilizes the fractured body part using cast or splint. So basically first physician will do manipulation like using the manual pressure. He will perform the proper anatomical position. Then he will use the cast or splint here. So how do we know? Based on the code itself, we need to know. So if it is restorative treatment, the code description should be closed treatment of ankle fracture with manipulation. Otherwise, closed treatment of metacarpal fracture, single with manipulation each bone. So if we have a finger fracture, if the physician performs restorative treatment, we need to code 26605, closed treatment of metacarpal fracture single with manipulation each bone. Closed treatment means physician will not make any incision on the fracture side and he will apply manual pressure using the traction, flexion and or extension and medial or lateral rotation of the fracture site. Each bone means each finger. Guys, tomorrow we will continue with few more emergency room procedures.